Hey there, folks. This is Alan Gorman. I'm the chair of the Department of Management and Marketing at ETSU, back with another episode of Bucs at Work, where we introduce and talk to some local business people about their careers and what they do. Today with us, I have Teresa Hicks. Teresa is an alum of ETSU. She graduated a couple of years ago with her MBA through our accelerated MBA program. And Teresa is the Director of Strategic Communications and National Media Relations for Ballad Health here in Johnson City. And she also is on our board of advisors for the Department of Management and Marketing. So we're very, very glad, very happy to have Teresa here with us today. Welcome, Teresa.
Thank you for having me.
I've got a few questions for you, so I'm going to jump right into it.
Okay.
Teresa, tell us about yourself and how you became interested in communications in the healthcare industry.
Well, I think like a lot of people, I think most careers don't take a linear progression necessarily, and that's definitely been true for me. My undergraduate degree is in English literature, and I majored in that just because it was what I was interested in at the time. I enjoyed writing and reading literature, and so that's just where I put my energy. And so during undergraduate, at some point you have to start thinking about what your career is going to be, what you want to do to make some money. And it was advised to me that I consider journalism as a career. And I tried that out, did some internships, and turned out to really like it. And so after I graduated, I went into newspaper writing here locally, started out at the Kingsport Times News, then worked for the Johnson City Press for a while. And internships included, I did about 10 years in journalism. And it was great. It was a very satisfying career, very interesting, a lot of really cool people that you meet, a lot of really neat things that you get to learn as a journalist. And as my career in journalism progressed, I eventually got put on the healthcare beat, so covering healthcare primarily, and I developed some contacts in the healthcare industry locally through that. And then when a PR communications role came open with what was then Mountain States Health Alliance, it was something to consider, and it was actually a difficult decision for me to leave journalism and go into communications because I was really enjoying journalism at the time. But it tends to be kind of a natural career progression for a lot of journalists, that they eventually evolve into some sort of PR communications role. And it was an opportunity that was too good to pass up. And so that's actually how I got into healthcare. And I'm really glad that I did. I've learned a lot of great things, and been able to expand my experience and meet some really fantastic people through that. But that's how I came into healthcare communications. A lot of people, I think, come into it from that same angle, that same path. I think a lot of people that end up in communications have started out in journalism. There's definitely an advantage to that. Some of them start out in marketing and they move into communications as well, and some go directly into communications.
Excellent. Well, like I said, we know you got your MBA at ETSU. What led you to choose ETSU for your MBA?
Well, the reason I chose to do an MBA at all was because I felt like it was going to be necessary in order for me to progress to the next level in my career. And the reasons that I chose ETSU, there were a couple of important reasons. One was the location, the logistics of being close to home and being able to easily access the classes and the resources that I need. And also at the time, Mountain States Health Alliance, and now Ballad Health, has the same relationship. of tuition reimbursement. And so I was able to have the program paid for by my company in exchange for my work for them. And they encouraged us to choose ETSU in a couple of different ways. And I was glad about that. I looked at a lot of different programs. I looked at programs that were completely online. I looked at programs that were based elsewhere. And just the cost and the convenience was a good match for me. That was the reason I chose the ETSU AMBA program to begin with. The reason I would choose it again, if I were doing it over again, I would make the same choice, is because of the format of the way that the AMBA program is put together. That cohort-based group, I think, was really valuable for me. And the quality of the education that I got was really good. And I've talked to some other folks since then who've done other programs in different places, you know, some online, and I have really seen a difference in the experience that I was fortunate to have compared to, you know, the experience that some others have had. So I would definitely choose ETSU again.
Awesome. That's good to hear. So what about the AMBA program at ETSU has helped you in your career so far?
Well, I think there's a lot of value in the variety of things that you learn in an MBA program. And I think that this particular program meets a niche for people who have already been in the professional world. They've had a career for a few years, and are looking to take on greater levels of responsibility. And from my perspective, for example, you know, I came into healthcare from a communication standpoint, coming in from journalism. Well, you know, that's one angle, but it's only part of the much larger picture, obviously. And, you know, as an undergraduate in English literature, I didn't get any training in business or finance or, you know, any of those types of things that are really part of the broader picture of running any kind of business. And the further you progress in your career, the more you're exposed or need to be exposed to that level of information about running a business. And I think that's true regardless of what business you're in. And so, you know, those pieces, especially the math, really for me, because, you know, I started out with English Lit, the finance and the accounting and all that stuff was really new to me. And it was something that I had recognized that was a gap in my knowledge and understanding. So I think that, you know, for that reason, getting an MBA is valuable, to be able to have the vocabulary to talk about, you know, with other professionals about the types of things that matter to your business on a macro scale. And I recognized too that, you know, really, if you're going to progress in your career to any significant degree of some sort, and this was just a really good fit for me.
Excellent, excellent. Well, we're glad you made that choice, Teresa. So what do you love most about your career working in healthcare communications?
There's a lot to love, really. And I think that people are fortunate if they get to work in an industry that has meaning for them. You know, not every job has that. Not every job has to have that. But it's definitely a perk when you feel like you're part of something that matters. And that's what I love about working in healthcare. You know, there's something that we frequently say in Ballad Health, and this was true in Mountain States as well. All team members are caregivers. And that really rings true to me very deeply. And I feel privileged to be able to be a part of that. And you know, what it means is that no matter what you're doing in the healthcare system, you're part of supporting patients. That's what we're here for, is to, you know, to help people, to make people better, to heal people, and to be there for them in some of the most difficult moments in their lives. And I love the fact that no matter where you are in the system, whether you're, in finance or administration or, environmental services, you're part of that team that's caring for people. And I love that aspect of it. And I particularly love the way that we work at Ballad Health, the way that communications is integrated into the administrative and operational decisions that get made. I think this is true in any industry, that communications done properly is part of the administrative team, and should have a seat at the table when operational decisions are being made. Because if you can't communicate something well, maybe you shouldn't be doing it. Maybe you should change the way, that you plan, your operations. And I have been very, very pleased and gratified at the way that communications is valued within Ballad Health. And I think a lot of organizations that do communications well do it the same way.
I love that. I love that, talking about having a career that has meaning. I think that's really important. And when people can find that goes a long way.
Yeah.
So then the flip side of that is, what's your least favorite thing about working in healthcare communications?
I think probably it's the other side of that same coin. When you're dealing with things that affect people's lives so intimately as something like healthcare, you have a lot of great opportunities to share success stories and inspirational stories, of people caring for each other. But healthcare also involves a lot of pain, and it can involve fear. Sometimes the outcome is not, what you would have wanted it to be. Sometimes clinically the outcome is not great. Sometimes we make mistakes, and sometimes our processes don't work the way that they're supposed to. And when that happens and communications ends up being involved, it can be very frustrating and saddening, to see when things don't work the way that they're supposed to work. But again, it comes back to the responsibility that we all have as part of the system and as leaders in the health system to make things right. So when things don't go the way that they're supposed to go, when something happens that shouldn't have happened, it's our responsibility then to take what we learn from that and apply it to next time, to keep these things from happening again. And so, I think those are the hardest times, when you have to see someone, having a frustrating time, or somebody that's suffering. But, being able to take that and apply it to the future, and, take those lessons learned is in turn can be gratifying as well.
Yeah, that's awesome. Yeah. So if one of our students were interested in communications in general, do you have any books or articles that you would recommend they took a look at?
I think that the answer is just read. And especially good journalism. Communications, I think in just about any setting is going to have some media relations component to it. So whether you start out, with any experience in media or not, you need to know how media works, because that's going to be a very important avenue for communication and connectivity with whatever community you're trying to connect with. And so the more you understand about how journalism works and what good journalism looks like, the better off you are. I would say, probably the best thing that you can do is read newspapers, national newspapers, New York Times, Washington Post, the biggies. They do some good journalism, and there's a lot that you can learn by seeing how people write. That's what they want to receive. And so when you're writing a press release, when you're communicating with media, communicating with the public, the more you understand about how the rhythm and the flow of their language works, the better you're going to be able to connect with your audiences.
So if one of our students was interested on the or in the healthcare communications aspect, what are some things that they should be doing right now to look into that?
Healthcare is an extremely complex and extremely volatile industry. There's a lot of very rapid change. And I think the best thing that you could do if you're interested in healthcare communications is to get familiar with the healthcare industry and the different trends and the different issues that leaders in healthcare locally and nationally are looking at. You know, there's been a lot of changes in the way that we get paid as healthcare providers, and you know the system is exceedingly complex in this country, and you know the policy decisions that get made, you know, can sometimes be influenced by politics and things like that. So there's a lot of nuance to know about. And so I would suggest, if somebody's interested in healthcare communications, to start reading, you know, when you're reading that those national, you know, articles and news coverage, read the healthcare industry publications, look at things like Becker's Hospital Review and the, you know, publications from American Hospital Association. Modern Healthcare has done some good coverage. And read the coverage that really understands the specific nuances of the industry itself. It's very different than the national coverage of healthcare that comes from that broader public perspective. If you really want to get down into the nuts and bolts of how the health system runs, read those industry publications.
Very good advice. Very good advice. So if you were back in college right now, what is one thing that you know now that you wish you had known then?
I think if I could talk to my younger self, I would probably reassure myself that the relationships that you form are what matters. The respect that you give and the respect that you earn from the people that you interact with as a professional is many orders of magnitude more important than any project that you complete or goal that you achieve. And one of the things that I learned really early on, and this is true in communications, it's true in any profession, right? One of the things I learned early on is, in business, everybody comes back around. And what I mean by that is, you know, when you interact with somebody in one setting, you may meet them again. You will meet them again in a completely different setting. They'll be in a completely different role. And you'll be glad that you treated them with respect and that you earned their respect in your previous interaction with them. You'll be doing yourself a favor if you treat every interaction like a high stakes interaction, and if you treat everyone like you're interacting with the most important person in the world. And one other thing, oh, sorry. One other thing that I would say is executive assistants run the world. So especially treat them with respect, because they give you access to, they are the gatekeepers for everything, and they absolutely keep the whole world running. And so, you know, particularly those folks that, you know, sometimes are underappreciated, really deserve your respect.
Yeah, I could not agree more. The folks on the front lines are doing the hard work, and they definitely deserve all the credit. Yeah, that's my favorite question to ask everybody on this program, because it's fascinating what people have learned since their time in college that ends up making a huge difference in where they're at right now.
Yeah.
So, final question, what are you most proud of in your career?
I think being part of the transition, the merger with Mountain States Health Alliance and Wellmont to form Ballad Health is definitely one of the things that I'm most proud of, and grateful that I got to be a part of that. It was a very long process that involved a lot of complex communications. It was about a 4-year process, and it involved communications on a lot of different levels, you know, within the community, within the business community, at the state level. I feel really fortunate that I got to be a part of that. I'm proud of what we were able to accomplish. And the thing that I think is most gratifying about that is I'm from this area, born and raised, grew up in Kingsport. And I love that I still live here in the area where I grew up, where my family is. And I feel like that being a part of that transition was really an investment in the community that I know and love. Really looking at rethinking how we think about healthcare in general, and how we think about wellness and caring for people in our communities. And it's another one of those examples of, you know, when you're fortunate enough to have a career that really means something, where you feel like you're actually, you know, contributing to the betterment of your community. That to me has been the most gratifying thing, and I'm so grateful that I've had the opportunity to be part of that.
That's awesome. Well, Teresa, thank you for your time. If one of our students wanted to get in touch with you, ask you a few questions, what's the best way to do that?
My email address is teresa.hicks@balladhealth.org, and my contact information is actually on the website, so my cell phone number is there too. So that, you know, they're welcome to contact me.
Awesome. Well, thank you so much, Teresa. We really appreciate your time. If there's ever anything we can do for you all at Ballad, please don't hesitate to reach out.
Thank you. Appreciate it very much.
Thank you. Take care.